Hello, I'm NurrieStearns. In this video, I'll be sharing some of the latest research on pain, along with what I've learned about reducing and alleviating chronic pain. Some of the topics I'll be covering: the mystery of pain, it's not what you think it is; understanding pain from the latest pain research; how emotions influence pain; and how we can unknowingly magnify pain; how beliefs about pain can undermine recovery, what helps, and 12 ways to reduce or alleviate chronic pain. I would like to hear from you as what's helped you deal with your pain. Please post your comments below. I've had chronic pain now for over 10 years. Of all the challenges in life, chronic pain has been one of the most difficult to deal with. Perhaps you have pain or know somebody who does. I hope you find some helpful ideas here on how to deal with pain. First, I will start with how I became a student of pain. I was taking some pilot safety training from a flight instructor, and he misjudged the altitude that we needed to be at to safely do a training maneuver. After the crash, the instructor pulled me from the wreckage and dragged me a safe distance from the crash site, where he left me so he could go for some help. As I laid there, I felt no pain, yet both arms were cut to the bone. I could move my hands and fingers, and I could see the arm bone through the wounds, yet there was no pain, even though I was profoundly injured. It wasn't until hours later that evening, at the hospital, that I started to feel extraordinary pain. I had a broken shoulder, broken ribs, broken ankle, and it took over 100 staples to close up the wounds on my arms. Over the years, what has given me the most ongoing pain is my ankle and foot from the several reconstructive surgeries. For me, having serious injuries after the accident, yet feeling no pain, completely challenged what I thought about pain. I started reading about pain as a way to understand. I found that it is common in severe accidents and in war, even with loss of limb, that the injured often do not experience pain right away. And those people who've had limb amputations often report phantom pains in their missing limbs. It was these two facts that piqued my curiosity about pain. I started researching. Of the medical doctors I talk with, I discovered that most had very little education or understanding of pain. After searching through many books on pain, I came across pain researcher Dr. Lorimer Moseley's work, Explain Pain. In his book, he points out that pain comes from the brain, not the body. That pain is a construct of the brain, meaning that the experience of pain is created within the brain. It may feel like it's coming from your joints, organs, or tissues, but it's really coming from the brain. Pain is all about protection. The brain interprets danger messages from the tissues, but the brain does not measure the condition of the tissues. One of the ways for us to understand how the brain can misinterpret sensory input to create pain is to observe how the brain misinterprets visual input. In this visual illusion, notice how the two spinning girls on the right and the left appear to be spinning in the opposite direction. And yet, the girl in the center seems to mirror the direction of either the girl on the right or the left. We know that this cannot be true, and yet this is what we see and experience. Likewise, the brain can also misinterpret input from joints, organs, tissues, and thoughts to create the experience of pain. In 2015, the American Journal of Neuroradiology published the following study. Researchers studied thousands of x-rays. What they found was that degenerative changes in the spine commonly occur in pain-free individuals and are likely a part of normal aging and not associated with pain. On the chart, you can see at 50 years old, 80% of the people had disc degeneration, but with no symptoms from it. That means that only 20% of the people experienced pain from disc degeneration. Also, you notice on the chart that at 40 years old, 50% of the people were found to have disc bulge with no symptoms. So why do some people experience pain while others don't, while having the same conditions? Let's look at some of the underlying pain influencers. Pain is influenced by emotions. Research studies have shown that people who tend to be depressed or anxious are more susceptible to pain. Plus, pain itself can make one depressed or anxious. Emotional responses to pain can include anxiety, depression, anger, feeling misunderstood, and demoralization. Although it may feel like it's coming from your joints, organs, or tissues, pain is also an expression of your state of mind. If you're depressed or anxious, you'll very likely hurt more than if your mood is lighter or more balanced. People who experience more negative emotions also report more pain. If you dramatize, you magnify. Catastrophizing or exaggerating actual or anticipated pain can cause higher pain, more depression, stress, and disability. Here are some of the phrases that I used earlier on when my pain was really high. This pain is killing me. It's like a knife stabbing me. It's like walking on broken glass. Beware of colorful and extreme descriptions of your pain. Research has shown that pain catastrophizing magnifies symptoms, leads to increased levels of depression, an increased sense of helplessness, anxiety, and functional loss. If someone magnifies and exaggerates their pain, they will eventually stop doing things because they have inflated their pain to such a level that they truly believe that they can't perform certain activities. Harmful beliefs about pain can undermine recovery and prolong pain, like a belief that pain is a sign of damage, or a belief that pain is an indication of injury, or a belief that pain means activity should be avoided, a belief that pain is uncontrollable. So what helps? According to pain researcher Dr. Lorimer Moseley, it's possible to retrain the brain so it's not so overly protective. Movement is vital. Movement gradually suppresses the pain system. Movement helps you learn. Start very small, even with just visualization. Remember, it takes time and effort. Dr. Moseley also said to be mindful of danger in me messages, what he called DIMS, and support safety me messages, what he called SIMs. Now, DIMS, danger in me messages, are thoughts, beliefs, behaviors, and attitudes that support a negative outlook, that things will not work out. DIMS are the if-onlys and the what-ifs. If-onlys are the thoughts about the past, and what-ifs are thoughts about the future. Examples of if-onlys. If only I would have listened to my intuition. If only I would have noticed his mental state. If only I would have, you fill in the blank. Examples of what-ifs. What if this pain never stops? What if this pain gets worse? What if I lose my job? What if, fill in the blank. When you are in pain, danger in me thoughts have a profound and immediate effect on magnifying your pain and suffering. DIMS create hopelessness, depression or anxiety, low expectation, lack of interest, fear of movement. SIMS, safety in me messages, are thoughts, beliefs, behaviors, and attitudes that support a positive outlook, that things will work out. Thoughts like, it's okay, things will work out, it's getting easier, even though it hurts, I'm doing pretty good, I'm feeling better. SIMS support moving through pain, being patient with our circumstances, having courage to do the best we can, and the persistence to live the best we can, making plans for the future. And here's 12 ways to cope with pain. Some of you, like myself, may find that with really intense pain, all methods to cope may become ineffective, and that for a time, the only thing that we can do is to endure the pain the best we can. Sometimes a method will work for a while to mitigate the pain, and then later it won't work at all. So if one method stops working, try another. Drugs. After being released from the hospital, I was convinced that I could recover without pain medication. After 3 days of constant agony, my wife convinced me to try pain medication. It was a huge help. I found that pain medication was essential for my healing and being able to somewhat function. But even with pain medication, the pain was still horrendous. Before taking pain medication, I was very concerned about addiction issues. My doctor was supportive and reassuring, saying, take care of your pain and deal with any dependency on the drugs after the pain subsides. When the pain subsided to a manageable level, I was able to stop the pain medication without any addiction to the drugs. Know that all drugs come with side effects that can affect your emotional and mental well-being, along with affecting your relationships. That being said, untreated intense pain by itself impacts your well-being and relationships also. Distraction. One evening while walking, I was experiencing intense pain. As I was hobbling along, I noticed a beautiful sunset. In that moment, with 100% of my attention on the beautiful sunset, I had no pain. Moments later, when I started to walk again, the pain was still there but greatly diminished. So, focus on a pleasant experience. A good movie, a book, something you really enjoy. It's essential to enjoy what you can. Seek support from family and friends. Supportive family and friends can be very beneficial to your healing. Notice moments of non-pain. Rest your attention on what doesn't hurt. Welcome the pain. This may take some practice, but I find it very helpful. When intense pain comes, open and surrender to the pain. When I'm able to completely surrender to the pain always dissipates. Start by gently opening to the pain, relax what you can relax, and breathe into the present moment experience. Cultivate safety in me messages, observe and release danger in me messages. For me, this has been a long-term ongoing practice of being mindful every day. Movement and exercise is essential. Remember, movement is vital to suppress the pain system. Start small, even with just visualization. Remember, it's possible to retrain the brain not to be so overly protective. Remember, it takes time and effort. Seek comfort. Make your life feel safer, gentler, more pleasant. Find a way to nurture your body. Talk with an up-to-date, educated pain professional or trauma-informed therapist. It can be very helpful to have professional support. Don't overdo. Be gentle with yourself. With activity, start small. Be mindful of your weight. Maintain a healthy diet so you can support a healthy weight. Some people lose weight with severe pain, Others gain. For me, I gained weight. When I was unable to walk or do activities, my anxiety increased, and I started to eat more. Having more body weight made me more sluggish. With less movement, I lost muscle mass, which made exercise even more difficult. So be mindful of your diet. And lastly, be open to being active. This is subtle, as pain at times stops us from doing the things that we want to do. But pain can also become a subtle attitude, limiting what we can and cannot do in life. In conclusion, just having this information changes nothing. To make it work for you, you have to practice. It may take time to experience improvement, but it does work. I would like to hear from you as what's helped you deal with pain. Please post your comments below. Thank you for listening.